Hello, and welcome to another episode of Podcast DX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be joining us this week.
And I'm Jean Marie.
Collectively, we are the hosts of Podcast DX. On today's show, we're speaking with Karen DeCocker. Dr. Karen DeCocker is the Director of Advanced Practice Providers at Stella, overseeing the assessment team. She helps to identify which innovative biological medical treatments and virtual therapies can help relieve symptoms of anxiety, depression, PTSD, and traumatic brain injury. After completing a virtual assessment of each patient, Dr. DeCocker and her team analyzed the medical, biological, psychological, and social factors to provide personalized treatment recommendations across Stella's advanced protocols, such as Dual Sympathetic Reset, Advanced Stellate Ganglion Block, Ketamine Infusion Therapy, Transcranial Magnetic Stimulation, or TMS, Spravato, Integration Therapy, and more. Dr. DeCocker's priority is the patient's outcome. She became a nurse practitioner in 2007 after 10 years of hospital nursing experience. Dr. DeCocker is joining us today to discuss using ketamine as a potential treatment for depression, which I would have a great deal of interest in. Welcome to our show.
Thank you so much for having me. I'm excited to share some information and see how I can help your listeners.
Thank you. Hi, Dr. DeCocker. I was wanting to know, and I wanted to start by asking, what led you to a career in nursing to begin with?
Oh gosh, the very simple version is I wasn't interested in going to school when I was younger, and I took a career path, actually became a certified travel agent of all things, back in the day when we didn't have computers to look those up flights for us, right? And while I was waiting to find a job, a friend of mine asked me to fill in for another receptionist at their doctor's office, and I never left. Essentially, I became a receptionist, moved my way up, and was encouraged to go to nursing school, and I eventually did. And I didn't take the traditional path. I had 2 young kids when I started nursing school, and I never thought I'd even go to college. Now I have advanced degrees, doctoral degrees, and not at all the life I envisioned, but nursing is kind of like that in the fact that there's ways to reinvent yourself over and over again, change, areas of interest, be in the public sector, in the hospital, in a private clinic, in the community. There's just endless possibilities, and I've taken lots of different routes throughout the time and find myself where I am in my career now, after leaving the bedside for a period of time as a professor at Rush. Now I'm back in patient care after seeing how we might be able to help patients who are most in need.
And it sounds like you always knew you wanted to help people. I mean, even as a travel agent, you're helping people, and a receptionist, you're helping people, and then you found your niche.
Yeah.
That's fantastic.
And it was actually a really amazing physician that I was working with that really inspired me, because he really showed me a different side of healthcare and was really caring, very nurturing. And I would say he acted just as much as a nurse as a physician, in the fact that he really paid attention to everything that the patient was saying to him, not just the very surface symptoms and things. And I just really was intrigued by his approach, and made me see doctors or medicine in a little bit of a different way than I had ever been exposed to. And so he was the one that suggested I go back to school, or go to college, not even go back to school, and work towards my nursing degree. And that's what I did.
That's fantastic.
Excellent. Yeah, we need more doctors like that.
Yeah.
Yes.
What is the difference between an MD, a DO, and a DNP?
Okay. So medical doctor, the MD, it's interesting. There's a lot of controversy around the doctor title these days. And it never was a problem before until nurses started to earn their doctorate practice, but we've always had PharmDs, we've always had PhDs, and in universities they're always referred to as doctors and, scholars. A doctor title just means that you have the terminal degree, the highest degree in your profession, right? And so there can be a doctor of many things, right? Philosophy, education, all sorts of different types. But traditionally, people think of a doctor in a medical setting as a medical doctor, which is fine. And so they have their doctoral in medicine practice, where a doctor of osteopathy, a DO, is still a fully licensed medical doctor, meaning that they have all the same rights, privileges, and the same level of education as an MD. They just have added in some more holistic approaches in osteopathy, and have a little bit broader spectrum of education, where a DNP, which is a doctor in nursing practice, which is what I have. So I do have my doctoral degree, and in the university setting, I'm always referred to as doctor. It's a little, interesting that there's some controversy around using doctor in a medical setting, and so you'll see that I almost always just have Karen DeCocker as opposed to Dr. Karen DeCocker. Because I never want somebody to think I have a medical degree. I have an advanced practice nursing degree, and so for me it was a total of 9 years of education, and that's because I have 2 advanced practice nursing degrees, and then in addition my doctoral degree. So Doctor of Nursing Practice means I take research that other people have done and apply it to my setting or my population, and analyze the outcomes from that. So it's much more research focused, but an advanced practice nurse or an APRN or an NP has very similar abilities as far as writing prescriptions, doing small procedures, taking care of patients, diagnosing them, and then we collaborate with physicians when we have a really difficult case that we might need some extra support in.
Okay. And to add,
Now, we didn't add physician's assistant.
yeah, I guess.
And I'm wondering, would a physician's assistant be on par with the DNP?
So as a nurse practitioner, yes, the DNP is more adding the research piece of it, and sort of extra scholarly time. The PA is a different model, meaning that they are not nurses first. They come and they train as exactly what the title is, physician assistant. And so they do have an advanced degree and can write prescriptions and things, but they have to work a little bit more closely with physician supervision. But they are advanced practice providers and, can diagnose, can order lab tests, can order medications and things in certain circumstances, but they work a little bit more closely with a physician one-on-one. We actually have a PA in our program, and she works alongside the NPs.
Okay. What led to your interest, rather, in psychiatric nursing in particular?
So interestingly, I started out as a labor and delivery nurse, and then went on to work in the hospital setting, in administration in the kind of childbirth area, and then went on and had my certified nurse midwife. So for about 12 years, I was delivering babies in a variety of settings. The last place I was working as a labor and delivery midwife was at Northwestern Hospital. A lot of people think that midwives only work at home or deliver babies at home, but during my career, I worked in a variety of settings. On my very first one, for the first 5 years, I was working in public health and working in a small clinic, federally qualified health center is what they're called, and working with people who have little to no access to medical care often. And in this particular population, there was a high prevalence of drug use and a lot of mental illness that was not addressed. It was not accessible in that community. So even as a nurse midwife, I was, ordering labs for, significant psych medications, was managing people with addiction, and all that comes along with that. So even from an early time, my practice involved a fair amount of mental health care. And this is also a time where family issues and problems and trauma often first appear.
Sure.
Is during pregnancy. there's a lot of family dynamics, a lot of family involvement, family issues that start to surface around a pregnancy and a new baby coming into a family. Oftentimes, this is the time when women first kind of address any sort of sexual trauma, or share that because of the intimate nature, obviously, of the relationship between the nurse midwife or their obstetrician and delivering. So there's a lot of things that pop up during pregnancy, and domestic violence escalates during pregnancy. So I was dealing with a lot of mental health issues, as any provider might in that setting. And it just became an area of specialty to me. And as I was a professor, when I moved into the university setting, that was something I really focused hard on with my students, and making sure that you're addressing all of the social aspects and all of the potential, psychiatric components, no matter what patient you're taking care of. It's, pretty important, obviously, to their overall health. And it just kind of blossomed from there. And as I didn't want to stay in the OB and being on call and working overnights and delivering babies, I just moved more and more into the psychiatric realm and pursued my advanced degree in psychiatry then.
Okay.
Very, very interesting way that you segued from a nurse, and when we picture a nurse, or when I picture a nurse, I picture the second hand of the doctor. I mean, I think that a nurse and a doctor absolutely need to work hand in hand, but your career path actually led you to a higher status so that you can work independently if you need to, which I think is wonderful, because now they're saying that there's a shortage of doctors.
Absolutely, there's a shortage of doctors, particularly in primary care, and in fields like obstetrics, because they're high intensity, lots of long hours, and also areas that require a lot of your time and attention. And so nurse practitioners have been around for quite the time. It's not something new. You just see us more and more visible. In the past, nurse practitioners often worked in areas or in communities that were underserved by physicians, but now, as the physician shortage has increased, and in specialties where there's fewer and fewer physicians going into it, nurse practitioners have become, extremely important, and are now sometimes the only access to care, because nurse practitioners are willing to work in communities and kind of work with populations that are not as lucrative, I should say, maybe, and are areas where the population is scarce, and so it's hard to recruit a physician to that area. And nurse practitioners and nurse midwives have kind of always filled that gap, but now people are seeing that the care that we provide is actually a little bit more comprehensive and holistic in many ways. That's not to exclude, not at all, better than, less than. It's just a different approach to care. And we certainly know when our population needs to have the expertise of a physician or a specialty, but we can meet the needs of many, many patients, especially in the primary care arena or in ongoing care like psychiatric care or obstetrics.
Excellent. And how has your extensive experience and education influenced your view of patient care?
Oh, gosh. I think, my education certainly influenced it, and where I was educated was in a university that they see the patient as a whole, as a primary. I graduated from Frontier Nursing University, which is in Hayden, Kentucky, started in 1939 as a nurse midwifery program. Not that we need to delve that long into that history, but it was built in a way of service. And so the founder, Mary Breckenridge, was the one that some people, if you're a nursing history buff or rural health buff, she was the one that rode on horseback down the creek beds to find the patients that needed help. And so that's deeply ingrained as a philosophy. But I think just the areas of medicine that I worked in, being labor and delivery, pregnancy, childbirth, and then now psychiatric, forms really deep connections with patients. You're forging really deep, intimate bonds with patients and are spending extraordinary amount of time with them, hours at a time in, labor and delivery. And then when I'm working in the mental health population, people are coming to me at their most vulnerable, sharing their, most difficult moments and asking for assistance in the fact that many of my patients now at Stella have had every type of treatment, have gone through every sort of medication and so forth, and they're coming to us kind of as a, desperate, after many years of looking for mental health assistance. And so it's kind of a moment of, I guess, humility and a patient being vulnerable and saying nothing is working and I still need help. And so it's kind of hard to not get into that kind of really tight patient care model that I seem drawn to.
Okay.
Thank you.
Dr. DeCocker, I was wondering, what is depression and what are some of the signs that someone may need mental health care?
So depression is really a huge spectrum, and this is what I say about all mental health symptoms. Mm-hmm. And we're very careful to talk about symptoms versus disorders. And in fact, like when we talk about post-traumatic stress, we call it an injury, post-traumatic stress injury, right, not a disorder. Basically, issues around depression, anxiety, insomnia, these are all symptoms that something's not going well in the brain or the nervous system. It's not necessarily a disorder. We don't say somebody who's having some chest pain, they have a heart disorder. Mm-hmm. We look at what might be causing their chest pain and we investigate and find the root of that and treat it, right? Mm-hmm. And then we can be very much more specific as, there was a valve that wasn't working appropriately, or there was, some of the blood vessels were too clogged, or whatever it might be, right? We don't say that the heart has a disorder or the patient has a disorder because there was a part of their body that wasn't working at optimal capacity. And so this is the same way we feel about the brain and the nervous system, is that when somebody is experiencing symptoms of anxiety or depressed mood, we want to know what's going on in the brain or the nervous system. In depression, there's very clinical definitions as far as, a loss of interest or pleasure in doing the things that you once did. A slow cognitive mood where your brain processing slows down, you may have less physical energy to do the things that you need to do, or the flip side, you might be very agitated and irritable. Oftentimes there's a lack of sleep or sleeping all day. Patients have a change in appetite. It may be they find themselves eating for comfort or they have no appetite. But there's a big list of things that kind of go into a formal depression diagnosis. And when you say, how do you know if you need treatment, is that are the symptoms affecting your quality of life, right? We all have periods of time where we maybe kind of have a depressive mood that's completely appropriate. Maybe there's been some big stressors in our lives, or there's been a loss in our life or something. So having depressive symptoms for a short period of time doesn't need to necessarily be treated. The difference is when it affects a person's quality of life. And when the symptoms are interfering in their ability to participate in life how they want to. And so that's really the criteria for treatment. And, I don't believe every simple change or every mood, everything needs direct intervention. Some things can be easily, improved over time. But it's when it's changing the quality of life, whether it's anxiety, depression, or any sort of symptom, that's when we look at seeking intervention and treatment.
Okay.
Excellent way to get into my next question. Dr. DeCocker, what is the typical course of treatment for depression?
So the very first thing is always starting with lifestyle changes, right? Is the person, living in an environment that is overly stressful? Is the patient's environment, like at work or school or in their relationships affecting their mood and their daily functioning? Is their, home environment safe? Are they feeling, adequately supported? Are they, facing any sort of, difficulties, financial, medical, child? looking at all of the things that are going on in their life really clearly and see what can be improved there, to see if some true supports can be of change or difference. Looking at sleep patterns, and the overall diet, and is the person getting outside, able to exercise? Those sort of things are the first interventions, but that doesn't change everything for everyone, right? Just like we can help the heart or other parts of the body by increasing exercise and diet. It's the same thing with mental health symptoms, is that if those measures aren't enough to change, then we look at, oftentimes patients will enter into maybe some therapeutic conversations, finding a therapist, working with an expert to talk about what's been going on, maybe what happened in their past, and trying to find ways to better understand what's going on in their life that might be increasing their depressive symptoms. Mm-hmm. The next would generally be medication, and sometimes patients see their primary care doctor, or maybe they become in contact with another mental health professional who can prescribe a simple antidepressant and see if that's effective. Unfortunately, antidepressants as a whole have about a 30% chance of working, even at the very onset. And each sequential medication, the likelihood of it working when the first one failed gets less and less. And a lot of people don't understand how low the success rate is with antidepressants. I still prescribe them. I still find them very helpful for many of my patients. So there's not an medication bone in my body. I've seen people's lives change dramatically with the appropriate medication and support. But unfortunately, medication is not always the answer, and adding more and more medications oftentimes gets things complicated, and then you're treating side effects, and kind of patients are seeking assistance, and the simple answer is try this medication, and oftentimes have been mismanaged for a long period of time, or have gone years and truly years and have tried multiple medications and things and are not getting better. So that's kind of the traditional path. And when that happens is kind of where we step in at Stella and look at what are the interventional things that might be of assistance that the patient hasn't tried.
Okay. And speaking of that, how might ketamine help patients living with depression?
So ketamine is a long-term, long-known drug as an anesthetic, and people joke about it being, it's a horse tranquilizer and things. Absolutely, those are true statements, but what we noticed is that patients, over the years oftentimes felt better after having some exposure to ketamine, and we didn't know really why, and we didn't understand why patients who were anesthetized with ketamine did better in certain aspects post-surgery. And, there was a whole evolution of looking at, is that, does that mean something, right? Mm-hmm. And this is how many drugs that started in one field kind of cross over into another. And so over time, it was recognized that ketamine works on the brain, similar to some of the other treatments that we see, like with medications and so forth. So ketamine actually, on the kind of broader picture, increases brain growth, and it actually influences the brain's glutamate system, and which is really involved in mood regulation and whether the brain can be plastic, which means that it can change, morph, and chain, and make new connections and make new channels where areas of the brain that don't normally communicate are now able to communicate with each other. And in all honesty, it also leads to an increase in the main neurotransmitter glutamate, and leads to growth of these kind of synaptic connections. And so it works very, 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 very rapidly. People who have severe depression can see relief in 1 or 2 treatments, and can go from, pretty deep depression, suicidality, and within 1 or 2 treatments may find tremendous relief. That does not mean that it heals depression forever and that, this is a miracle cure where after 2 treatments, everything is better. What it does do is stimulate changes in the brain that allow things like therapy or, other habits such as sleep and so forth to actually be productive and work.
So it could be supportive.
Yes, and so it actually is. It's an interesting thing. Ketamine and the drug lithium are the only 2 known medication treatments that can significantly improve suicidality. So it's not just a supportive thing. It can be truly interventional and can be extremely life-changing, and we're seeing this used more and more in an inpatient setting. Actually, it didn't ever used to be used in an inpatient hospital, but people who are hospitalized now for severe suicidality or a suicide attempt are now being administered ketamine as a big kind of jumpstart boost, because it actually increases the, it's kind of complicated, I don't know how far you want me to go into it, but the brain-derived nutrient factor, which activates the, signaling pathways in the brain, and it's what allows the brain to grow new neurons and, increases the productivity in the motor pathways. And so it is actually a very potent and very effective drug for really severe cases. But then in smaller doses can be used for maintenance, and then it becomes supportive, as you might have mentioned, as you kind of mentioned, is that it becomes supportive in the way that over time, smaller doses spaced much further apart can provide relief ongoing and what we call maintenance. And that's where you see the drug Spravato, which is a nasal spray, which is covered by insurance. It's a long-term therapeutic relief that was approved by the FDA and covered by health insurance. It is administered in a clinic, but after patients kind of get past the period of significant depression and severe symptoms, we can help maintain it just by, every couple of months, every couple of weeks. It depends on for the, which patient and what works for them. But we do an intensive course, and then we can use the drug Spravato as a maintenance for patients who got really good relief from the ketamine.
Okay. And why is it so vital to receive ketamine treatments in a treatment facility and have them administered and overseen by a qualified healthcare provider?
Just like any other substance, opioids and so forth, are the ones that people are most familiar with. Any drug can be used as, a recreational, medication, and you'll see patients who have, or people who use ketamine, just like opioids, in a recreational sense. But ketamine is actually, it is a tranquilizer, right? And in the inappropriate dose can cause respiratory depression, can cause, we know and we expect that it's going to increase the patient's blood pressure during administration. So it's really important that we watch and monitor the patient's blood pressure during. And it does cause a dissociative state, meaning that the patient is not fully lucid and will have, what do we want to say, dissociative state is the right word. It's kind of like a dreamlike state where the patient may have some visual hallucinations, may feel some, body sensation changes, which for some people sounds inviting and enticing, but for other people, it can be a not so, exciting experience on their own. And so patients really love the support and feel safe in that environment. And most importantly is that we control the dose. And, it's very precise calculations to make sure it's a safe amount that's effective, will provide mild dissociation, but it's fully within the patient's control. And the most important thing is that if there was something that happened or if the patient became, upset or uncomfortable, we're right there to support them. So we offer ketamine in 2 forms at Stella. IV ketamine, which is run through an IV drip, and it's administered, we base it on body weight, and then it's, milligrams per kilogram for each patient. So everybody's getting the appropriate dose. And if something unpleasant's happening, or if the patient's blood pressure does begin to spike to a level that we're not happy with, we can stop the administration immediately, and monitor that patient until the effects wear off. And then with the Spravato nose spray, it's very, very titrated, very calculated, and controlled dosing that we know is completely safe for a patient, to be administered. But the same thing, we watch their blood pressure and monitor them for a period of time after administration to make sure that they're safe.
Okay.
Thank you.
And you were saying that it's not always a pleasant experience for everyone. We spoke with Travis Mills, who is a quadruple amputee as a result of an incident.
An IED in
during
Afghanistan.
his military experience. And as part of his recovery, he did utilize ketamine. And he said the actual experience of, his experience was not pleasant. And he said, like at the time, he thought, this is not a good idea. But he said the benefits were utterly shocking. He was surprised at how amazing he felt afterwards. And I don't know if you've seen how what an amazing speaker he is. And he provides motivational speeches across the world, or around the world, across the country. And it really changed his entire life, which is, not that alone, but all of, the support and everything. But it was a key factor in that. And then also the author, Jenny Lawson, has been utilizing or receiving ketamine treatments as well for her severe and crippling depression. And we're all witnessing, that online and through her social media, which is an interesting journey to watch. So yeah, I can definitely see how not everyone thinks of it as like a fun recreational thing. It's actually you're doing work. You're doing work.
And so I also want to be careful, because I don't want to scare people away by thinking that it's like awful experiences. That's part of having it done in a controlled environment.
Right.
Is that as a ketamine provider myself, is that we start at a specific dose, change it based on the patient's response, and I can increase it or decrease it based on, the experience that they're having. And so I definitely work very hard to make sure that it's a positive or neutral response. Maybe some of the things that they experience, like understanding their trauma and things afterwards, doesn't always feel positive, but any true work, is like, physical therapy, mental health therapy, talk therapy. Those things should be difficult. Otherwise, you're just venting, right? And so we work very hard to make sure it's never a scary experience. And it's very rare, honestly, for people to have like an unpleasant, like, I didn't like that type experience. Because if that happens, it means that their dosage, could have been tweaked a little bit, because we don't want to push people into that sort of state. We're very clear that our patients should be able to, in the experience, say, nope, I don't want to think about that, or I don't want to go there, and basically can change the direction of, the journey.
Yeah, in Travis Mills, in the documentary that he filmed, he ended on that note that it was a tough thing. And he said that he wished if there was anything he could redo about that documentary, it would be that, so that he could show or explain to people that, it in that moment it was challenging, but it was well worth the going through that. And I can't even imagine having to process everything that, he had gone through.
Right, of course.
Yeah.
Dr. DeCocker, what are some of the possible contraindications for ketamine? You were saying that it can raise the blood pressure. So does that mean a person that has high blood pressure cannot get ketamine, or does that just mean you have to be a little bit more careful?
Right. And so, of course, that's one of the factors that we consider. And, if somebody has a wildly out of control blood pressure, yes, it would probably be contraindicated, because we know that there is going to be a blood pressure spike during it. That's the normal process of the ketamine experience. And so if somebody has really high uncontrolled blood pressure, no, they're not going to be a candidate for ketamine.
Okay.
There are a few, but interestingly, not a ton of complete contraindications. And some of them are coronary issues, like, recent cardiac events. people who have active psychosis, meaning that they have schizophrenic episodes. They may be able to be administered ketamine in a hospital setting, but it wouldn't be something that we would do in an outpatient setting. Patients who are having active manic episodes, same thing. Doesn't mean that they could never have it. People who are in the midst of a current opioid addiction, we won't treat them in an outpatient setting. But interestingly, there's a lot of data that's coming out that when patients are in recovery and who are living in a sober, lifestyle now, it can be very helpful to prevent future relapse and decreases cravings and things overall. But when somebody's who's in an active opioid addiction, we're very careful there. People who have increased intracranial pressure issues, they have had a brain tumor, or they have, there's very specific things, and that's part of why it's so important to be working with a skilled, reputable medical professional to administer this, because though there's not a lot of contraindications, there are some, and we want to be very careful. And so this is why every single one of our patients meets with a nurse practitioner first, goes through their health history, and we screen very carefully for the things that would, show us that that patient was contraindicated for ketamine.
Thank you.
Okay, great.
Good information.
Yeah. Dr. DeCocker, what are some of the possible side effects of ketamine treatments?
So all the side effects are very time limited, meaning that it's very similar to other anesthetics. Sometimes you'll see some nausea, some dizziness, some motor impairment, but those are all honestly expected, not the nausea, but like the impairment in motor functioning. This is why we keep people there until the effects have completely worn off. So oftentimes we'll see patients, have to rest for about 30, 40 minutes afterwards as the effects wear off. In the IV setting, it wears off very quickly because we do a low, slow dose. And so once the administration is done, within 5 minutes or so, they're actively talking, having something to eat and drink afterwards. We do some preventative things to prevent the side effects like nausea, and, by giving a little bit of medication through the IV to prevent the, patients from, experiencing that at all. But other complications are the things that we control for, like blood pressure and, making sure that they're medically safe for it. Any medication or anything can have a whole host of side effects, but the most common side effects are things like nausea, headache, and, some balance issues and stuff that wears off, honestly, pretty quickly after the administration's over.
Okay. Thank you. Now that we have a bit of background information, it's time to talk about our own initiative. To better serve our listening audience, we are an affiliate of a major medical supplier here in the United States, and you'll find affiliate links on our website, Podcast DX. And we aim to tailor specific medical supplies and equipment based on your diagnoses to make it less stressful than looking through an entire catalog for what you might need. We're open to your suggestions and will adjust our offerings based on what you, our listeners, find helpful. But now let's return to our show. Dr. DeCocker, could you tell us more about your role at Stella Centers?
Sure. My role is I lead a team of nurse practitioners who are responsible for, first, the full evaluation of the patient. As you mentioned at the beginning of the podcast, we do a medical as well as a psychiatric and psychosocial review of what the patient may be experiencing. But I want to stress that we don't get into deep trauma work with patients. This is not the appropriate location or the setting for this. When patients come to us, we're much more focused on what their specific symptoms are, and then understanding what it is that's going on with them as a whole to make sure that what we have to offer is the best match for them. So when you're saying what would be a contraindication, if we discover something like that, then we can adjust the treatment options to something that would be safe for an individual patient. As you mentioned, we have 2 forms of ketamine. We offer transmagnetic stimulation, which is highly tolerable by many people, also used for severe treatment-resistant depression and OCD. And that can be used in patients down to the age 15. And we also offer the advanced stellate ganglion block for other patients who are experiencing severe post-traumatic stress or anxiety symptoms. So my job is to talk with a patient, figure out what is going on with them, figure out what their symptomology is, again, because it varies from person to person, and make sure that the treatments that we have to offer are both safe and most effective for the things that they're experiencing. Then my team also follows up with the patients in between treatment sessions or after treatment to make sure that their symptoms have been helped as much as possible. And we do offer very brief, very concentrated, what we call integration sessions during ketamine to help the patient make sense of the journey that they've experienced. Like, what did they see? What did they feel? Who appeared, who didn't? What were the sensations and the emotions that they experienced? And trying to help them make sense of that and find some kind of patterning and find ways to use that information, in their healing journey. But my other role is then we have locations throughout the country in New York, DC, Boston, 2 in California. And I make sure that all of the clinical processes and all of the providers that are working in our clinics administering ketamine, Spravato, TMS, and so forth are, very educated, very trained, and following the same protocols so that your experience is the same no matter which Stella location you visit.
Okay.
Nice.
Thank
And
you.
is the ketamine treatment covered by insurance at this point?
IV ketamine is not. We have an agreement with the VA, and so in some of our locations, some of the VAs are having to send their patients out of the VA system because they can't handle the patient load. And so currently our Westmont, Chicago location has an agreement with Hines VA, and we're able to offer ketamine through their community care program. That's one of the few insurance coverages, which is interesting because the VA doesn't cover a lot of things, but they do cover IV ketamine. The Spravato which is also a ketamine, but administered via nose spray, that is covered by most major health insurances.
Thank you. Okay. Thank you very much. Yeah, Jean and I both are patients at Hines.
Oh, interesting. Okay.
Yeah, and we're aware of some of their acupuncture.
Mm-hmm.
They allow acupuncture outside of the VA system now.
Right.
Thank you very much.
Of course.
And what can a new patient do to facilitate their mental health care?
A new patient coming to Stella, or
yes, it just and in general.
So first of all, it's just really recognizing that a variety of symptoms are not any sort of failing or in control of that person any more than, pain in their back or, chest pain or, GI distress and things. Is that, yes, there's probably things that maybe throughout their lifetime, increase the probability or, were part of what led to these symptoms. But that doesn't mean that they're any more in control of it than you are for any other part of the body. So having insomnia, having anxiety, being hypervigilant, having feelings of lack of joy and just depressed mood and inability to engage with others is not something that's in control of the patient can just snap out of any more than somebody can snap out of having a stomach ulcer, right? Mm-hmm. And so it's understanding that there is help, and that despite the fact that they may have not found relief in the treatments that they've tried first, that doesn't mean that there is no relief or no hope. We just keep seeing more and more treatments available. And if you would have asked me 5 years ago, about ketamine or, the stellate injection, I would have not had much to say, even working at Rush University, which is a huge medical institution. But these things are now becoming very commonplace and are extremely successful. And so there are things that patients can do, and there are treatments that they may not have explored, and that don't be discouraged. Just like, sometimes when you have an infection in your body, the first antibiotic you try doesn't always work, right? And that this is no different, and that they deserve to have somebody really listen to what's going on and help them figure out what it is that we as a healthcare provider might be able to, find or understand, so that we can treat it appropriately.
Okay, thank you.
Thank you. What advice do you have for current or prospective nursing students?
Oh, wow. Okay. Is just get through school. And it seems hard, and it seems like, I don't know what I want to do, and I'm not sure I don't know if I want to work with kids or I want to do this. That's very common as people enter the nursing field. And as you go through nursing school, you'll find patients, or there's something that draws you to a certain population, whether it be pediatrics, geriatrics, oncology, psychiatry, labor and delivery. There's so many careers that are possible, and it is the one field that you will never be unemployed if you don't want to be. And it could be that maybe you're not working in your first choice for a period of time, or you have to work a different shift. But there is such demand for nurses in every sort of capacity and field. And, you can work in the insurance industry. You can work as a nurse working with attorneys. You can be a nurse working in a school, or, teaching. And, you don't always have to be at the bedside. It's the most versatile career, and it's highly paid, and nursing is more and more recognized as the profession it is, and there's a lot of respect and autonomy in this work, and you can find your niche no matter what it is.
Okay,
excellent advice.
Thank you. Dr. DeCocker, how do you personally maintain a good work-life balance?
For me, in the setting that I'm in, is that I make sure that I have time away from my desk or having direct patient interaction, that there's, a space between appointments. And at the end of my day, again, I'm not working in a hospital setting. So at the end of my day, I make sure that I finish what I need to finish, and that I can leave things till tomorrow, right? Things that are not urgent. I don't have to continue to work into the evening. And if my workload is so high that I'm working very late and very early mornings, then that is the first thing to me to say, listen, I need to delegate some of this, find better pathways, or offload some of this work. I no longer feel like I have to do everything, and that I have to, work tireless, endless hours. And I now advocate for myself, and then also my team. And when they're off, I work very hard to make sure that nobody contacts them unless it's absolutely necessary. And as their manager, I want people to call me first. If one of my practitioners is off on a certain day, I make sure that that's their day off. And when I'm off, I really take the time off too. And also, because I work in the field of mental health and trauma, hearing people's stories, and very difficult stories oftentimes, or even as a midwife, you have a very long, stressful birth or something, is that I recognize that. And if I need to take some personal time away, I will do that. And I've had days where if I've interacted with a patient that, that visit was very, stressful and in high intensity for myself, I don't have a problem asking somebody else to see my next patient, or to tell my, nurse, can you call the patient and say, that I need an hour or something extra or whatever, because I prioritize that for myself, and making sure that if the load and the stories and things are too heavy, that I kind of set some parameters around that. And just recognizing that what I do is hard, and hearing people's trauma and hearing people's stories, finding ways to not take that information away from the work, and separating my work from my own personal life. I don't know how to better describe that. You kind of
No,
No,
that was
very well. Yeah, you
very
described
well.
it very
Yeah.
well.
So far, we're very impressed with how you.
You're
You're a
stating,
good manager.
Yeah, and you're explaining everything very clearly.
Yeah. It's not because I actually take it very personally from my patients,
sure.
right? And I'm super emotionally connected and involved. One of the nice things about this job is that I have a very intense relationship with our patients as they're going through treatment, and then they move on, right? So
Right.
they come to me, I can apply very healing modalities, and hopefully they leave me much better than they came. But it's very different than like somebody who's treating somebody ongoing. I've been in a role where I had a patient population where I'd see the same people every month and things, which is nice too. But then, I'm always seeing fresh new faces. I get to treat them, make them better, and help
Right.
them get better. And then they move on. And so even though it's intense, by moving into this job, it's a whole different experience, right? And I left a job where I was treating patients long term and long relationships because I was so energized by seeing people get so much better. And so I have these kind of brief short. And so for me, that was a way of maintaining a work balance in my life, right? Is that I didn't have these people that I was thinking about for 6 months, a year, and things that, I was worried about. The people who come to me, I get to see them better. And that's hugely rewarding. And, part of why I made the switch into this role, honestly.
That kind of opens up the possibility for another episode coming up soon. How, as a long-term care provider of mental health, how do you? Yeah. So what do you do for stress? Do you hit a racquetball, or do you make clay objects, or butterfly collecting? What is your go-to for stress?
I was going to say that's such a weird list.
Butterfly collecting and pottery.
It's an eclectic list. Okay.
Yes, an eclectic list. So I actually like to just kind of putter around in my yard. I'm a very hobby. I have a neighbor. When I moved, I'm in Michigan, and when I moved to my house now, I have a neighbor who's 82 and runs circles around me and had the most gorgeous yard ever. And I would by default comparison, whatever, living next door to her, I couldn't have a really ugly yard, right? And because hers is so gorgeous that it just by comparison. So I spent a lot of time and got to know her really well. And, she was a master gardener at one point, so she's taught me lots of things. So puttering in my yard is one of my favorite things. I would love to. I'm always brutally honest with my patients. Just because I can tell you what to do does not always mean that I do what I know would be best, right? I should be exercising more. I should be, really delving into some of the hobbies that I used to follow closely. Right now, I've been working a lot. So the summertime and getting out in my yard is probably the one thing that I do. And the other thing is now I never in my life used to watch television ever. And now I allow myself to find like a Netflix series or something and spend an hour or two, watching or binging episodes as a brain release kind of thing. And yes, I watch really good shows, but I also watch some of the trashy stuff too, just because it's just a brain break. And several of the people in my office all watch similar shows like Love is Blind. I hate saying this in live, but then we all will send each other text messages during it and laughing about it. And then they always want me to diagnose people and stuff
I was going to say, do you sit there and diagnose people from reality shows?
That's fun.
Yeah. I've always wanted to see that as like a podcast where you're watching along with someone diagnosing everyone.
Ooh, that's a great idea, actually.
I like that.
Oh, yeah. I think that would be really fun.
But
and educational.
So I do just silly things like that. But as you bring it up, like I should be better about exercising, doing some things like that, and making sure that I'm eating really healthy. And I go through streaks just like anybody else.
Sure.
I always want my patients to know that I have lots of failing in my own journey, and there's times that I take better care of myself than others. And myself and probably about 75% of the people that are in our company have all utilized the services and the treatments that we offer in some capacity. And I'm not shy of that for myself, some of my family members, and I believe in what we do. And we as a company, all of our employees have access to all of these treatments, and we're very, very big on mental health and awareness within our company, of course.
That's fantastic.
Mm-hmm.
Yeah, and this way, you're not only, you're not only I can't think of there used to be an ad read for like not only whatever it is. Okay, never mind. Not only a hair club member, but you're also a patient. But
right, yes, and
yes.
I am very, very, very upfront and clear with anybody who asks me, and I tell my patients the treatments that I've received, and I actually became interested in this through my patients, and then my curiosity was enough that I myself went and had the advanced stellate ganglion block, because I was like, well, if it's working so well for all of them, what could it do for me? And, so it's been my own journey that really cemented my desire and my process, in working with Stella.
Right. And I guess your belief in seeing that it actually works.
100%.
Yeah, that's fantastic.
And I'm also very clear that, a couple of my children have had treatment and what they've done and why, and, of course, with their permission. But patients always love being able to hear my very personal experience and what was it like for me, and what were the things that I experienced and why. And, I'm willing to do anything that we offer if it, if it's appropriate for me, and all of our employees, the same thing.
Okay. Thank you. And Dr. DeCocker, thank you very much for taking the time to talk with us today. How can our listeners learn more about you and Stella Centers?
So certainly, we're easily available on the web through social media. We have, Instagram, Facebook, TikTok, but going to our website, stellacenter.com, I'm located on there, but also there's kind of general mailboxes that if somebody is interested in speaking to me directly, they can just put a message in there that, I'd like Dr. DeCocker or Karen. Honestly, you guys called me Dr. DeCocker throughout this whole episode, but all of my patients just call me Karen, and, say I would like to talk to Karen, and, messages will be routed to me directly. But our website has so much information, and there's lots of videos. There's lots of educational pieces. It's not just if people want to understand more about mental health and different mental health concerns, we are really good about putting research as well as personal stories and kind of blog posts on all the different mental health topics and treatments, and not just the ones that we offer, because what we do is not appropriate for everybody, but we want to provide lots of education and support that way. But we have forgive me for not knowing the location of your podcast. I don't know if this is much more of a regional or national.
No, we are definitely worldwide.
Okay. So is that we actually have locations outside of the U.S. We have clinics in Australia as well as Israel, but we have locations throughout the U.S., not just the Stella centers themselves. We work with physicians and train them in our techniques for the advanced stellate block. So throughout the U.S., there are options for treatment, but they all begin with an assessment with a nurse practitioner. Our numbers are widely available on the website, and there's quizzes. If you want to talk to a care advocate and decide if you want to make an appointment, there's lots and lots of ways to obtain information, both about specific treatments, but also just kind of in general and what might be available.
Okay, great. We'll definitely add a link to Stella on our webpage for this episode.
Right, definitely.
Thank you.
Perfect.
And thank you for taking the time. We really appreciate it.
Of course, it was my pleasure. My pleasure.
If you have any questions or comments related to today's show, you can contact us at podcastdx@yahoo.com. We have a website, podcastdx.com. We're also found on Facebook, Twitter, Pinterest, Instagram, and TikTok. And if you have a moment to spare, we'd appreciate a review wherever you get your podcast.
As always, Please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or a treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard of this podcast.
Till next week.